Hello, my name is Amy Layton.
And I'm Luke Miller, and this is Tea Time in Olympia.
Join us this month as I continue my conversation with Dr. Ellen Hardin. Our topics will be physical transition, hormone replacement therapy, or HRT, as well as some common surgical options available for trans and gender nonconforming people as part of transition. Also joining me is Ari LaTourette to discuss WA-Safe Alliance and Organizing Trans Olympia.
June is LGBT Pride Month, and I'll be talking about LGBT history, as well as Capital City Pride and Mpowerment.
So let's jump on in. Hello. We are joined again today by Dr. Ellen Hardin. She is joining me to discuss transition and hormone therapy. So let's get right to it, and thank you for joining us, Dr. Hardin.
You're welcome.
Let's start with transition. Could you tell us a little bit about what does it mean to transition?
Transition is when a person who identifies as a different gender identity than they're born with chooses to begin living their life as the gender identity that they choose or that they feel that they are internally.
Do all transgender people transition?
No, they don't. I think it's a matter of what can you live with and what are you comfortable with. Some trans people acknowledge who they are, but continue to live in the gender identity that they were born. Others choose to express their gender identity at certain times and not others. Some, for instance, work in their natal gender identity, but at home live in their preferred identity. Other people choose to take hormones to feminize or masculinize themselves, depending on what their gender identity is. And some choose to have surgeries to make themselves feel more complete.
Could you tell us what are some of the health risks of transitioning?
Well, if it's done properly under medical supervision, the risks are relatively small. We do know that there's some increased risk of cardiovascular disease, for instance, heart attacks, strokes, blood clots, and so forth. We don't know that much about the long-term effects of patients who have transitioned because we just don't have enough historical data at this point.
Okay. If a person decides to transition, what sort of steps should they take? What are the first steps that you should consider taking?
Well, the first thing you should do is find a doctor that is familiar with dealing with transgender patients and see them, and they can start the process. As a general rule, after you've discussed this with them, they will refer you to a counselor that is knowledgeable in trans issues. And the patient will explore their gender identity at some depth. This is probably the biggest decision a trans person is going to make in their life, so it doesn't make sense to do it on a whim. And it makes sense to have a counselor ask the tough questions and really explore whether you're ready to do this. After the counselor has seen the patient for a number of times and feels comfortable that they're making the right decision, then they'll provide a letter to the prescribing physician saying that they've seen the patient, they've examined them, that they don't have any other medical or any other psychiatric illnesses that would complicate the issue. And if they do have other psychiatric problems, that those are under good control and that they're able to make a good decision and that this is the right step for them. At that point, they see a prescribing physician who will begin to prescribe hormones. That needs to be monitored with lab work periodically. And the patient needs to be followed in the doctor's office to check blood pressures and so forth to make sure that nothing bad is happening and to monitor the response to the hormones. After the patient has taken hormones for a period of time, they generally begin to live full-time in their gender identity. and after they've lived in their preferred gender identity for at least a year, then they become eligible for surgical procedures.
And that's living full time. That's not just
That's correct.
every so often kind of thing. That's every day living as your proper gender.
Yes, that's what used to be referred to as the real life test. The criteria for that have been relaxed somewhat in recent years, but I think it's still an important step to take before anything truly irreversible is done.
Or what are the differences between transitioning at a young age, pre-puberty, or during puberty, versus transitioning as an adult or later in life?
Okay, well, a lot of it depends on how supportive parents are, but if parents are supportive, then transitioning in the pre-pubertal period is far preferred. The children do well. They don't tend to have the issues of depression and anxiety that trans people have when they transition later in life. They don't develop the secondary sexual characteristics of their natal gender, and we can provide secondary sexual characteristics of their gender identity. They pass better, so to speak, and they have an opportunity to be socialized in the gender that they feel that they are. They do better in every respect than trans people who transition later in life.
I imagine so. Is gender confirmation surgery, also known as sexual reassignment surgery, medically necessary, or is it a purely cosmetic kind of surgery?
Well, certainly for some patients, it's medically necessary. If you live your whole life in a body that feels foreign to you, you struggle with depression and what's called body dysmorphic disorder, and you really struggle. And gender conforming surgery relieves that for a lot of people, and it makes a huge difference. In some instances, I think it can be life-saving because it helps alleviate the gender dysphoria or the feeling of discomfort of living in a body that doesn't match who you are.
Talking about surgical options, could you go over a few of the surgical options for male to female transgender patients?
Okay. So for a male to female, the first surgery that they generally have is so-called top surgery or simple mastectomy, where the breasts are removed and reconstructed in a male configuration. That generally occurs some months after they've started hormones. It is no longer required to live a full year for a male to female before they can have top surgery. Bottom surgery or genital surgery for males to females is still somewhat problematic. There is the surgery called metoidioplasty, in which the clitoris is detached from the pubic bone, which allows it to spring forward. With the effects of testosterone, the clitoris enlarges, but it still only gets an inch and a half long. There is a newer procedure called ring metoidioplasty, where a piece of the labia and surrounding skin is used to hood the labia, and in that surgery they can internalize the urethra, so basically they can stand to pee. Some of those patients choose to have hysterectomies. Some choose to have vaginectomy or to have the vagina removed and closed. You can use the labia to create a neoscrotum, and you can use testicular implants to create a pretty good looking male anatomy, except that there's micropenis. The most radical surgery is called phalloplasty. It's a multi-stage procedure, I think currently 4 to 5 different surgeries.
Oh, wow.
In which a piece of either the leg or the forearm or the abdomen is freed up and created into what's called a pedicle. In other words, it sticks out. And you make sure that it has nerve and vascular supply, and then that is attached to the pubis and hooked up to nerves and to blood vessels. Unfortunately, that procedure is fraught with a lot of complications. Currently, about half of the patients who have that report chronic pain. Only 9% report any erogenous sensation whatsoever. The cosmetic results are very good. There tend to be a lot of complications with internalizing the urethra in the neophallus, or the new penis, essentially. And we have a long way to go on that surgery. Currently, I do not recommend to my patients that they consider phalloplasty.
Well, we just went over some of the surgical options for female to male patients. Could you tell me some of the surgical options for male to female patients?
Okay. For male to female patients, breast augmentation is a possibility, but it's usually unnecessary if they will be patient enough. You know, a pubescent girl doesn't develop breasts overnight. It generally takes 2 to 5 years for her to get full breast development. And trans women are no different. Once they start hormones, generally over the course of 2 to 5 years, they will develop breasts. We ask them what breast size their mother and their sister are, and we tell them to subtract 1 cup size, and that will give them an idea of what to expect. As far as gender-conforming surgery, after they've lived a year in role, then they're eligible for gender-conforming surgery, and that generally involves what's called penile inversion. The skin of the penis is preserved, and the internal parts are sacrificed, with the exception of a small piece of the very tip of the penis, which is made into a clitoris. And it's important that your surgeon preserves the blood supply and nerve supply to that, so that these patients will have erogenous sensation. The skin that used to cover the penis is then turned inside out and used to create a neo-vagina, or new vagina. That generally has a very good success rate. It requires that the patient dilate frequently after surgery. After my surgery, I was required to dilate 4 times a day for the first month, twice a day for 6 months, and then at least once a day for a year. I think that that's a very good surgery for a trans woman who identifies as lesbian and is not planning on penetrative intercourse. For patients who are attracted to males or plan on having penetrative intercourse, it's a less good option. It takes a lot of dedication with dilation to make it work. There is another procedure that is not commonly done, in which a piece of the sigmoid colon is used to create the neo-vagina. And that has much better stretchiness, so it's less of a job to keep it open, and it is self-lubricating because the lining of the colon produces a little bit of mucus. Unfortunately, the lubrication doesn't stop, so you always drip a little bit. Mm-hmm. But for patients that are attracted to males and desire to have penetrative intercourse, it really works much better.
Oh. And you've gone over the surgeries, but could you tell us a little bit about how patients go about obtaining these surgeries? What are the steps to be able to get the surgery?
Okay. Well, at least in my practice, this is guided by the WPATH guidelines. WPATH is the World Professional Association of Transgender Health, which is an international organization which sets guidelines for care of transgender people. So you start out seeing your doctor, you go for counseling, you start hormones. After a period of at least a year of hormones, then you can be referred to the surgeon. You require 2 letters, one from a PhD level, either physician or psychologist, and then another letter from a master's level person recommending the surgery. At that point, you can schedule surgery and go forward.
Now that we have covered a little bit of the transition process, why don't we move on to hormone replacement therapy? It is by far the most commonly used kind of therapy for trans people. Could you tell us a little bit about what is informed consent?
Okay, informed consent means that I, as a physician, have discussed with the patient what they're going to do. I have presented the options of what is available to them, and they have made an informed choice about what therapy they're going to embark upon. Now, in trans people, it's not just as simple as saying, this is what I want to do. You are required to have counseling and so forth ahead of time. As I've said in the past, this is probably the most significant decision a trans person is going to make in their life. It's going to have an impact on everything that they do from now on, the way they live their life. It's not a decision to be taken lightly. It's something that you want to make with a good deal of thought.
It's not something you can just jump into, is it?
Well, some people do, but it's not advised.
So you've gone over a little bit about what informed consent is. Could you tell us, or could you help explain, is informed consent enough?
Okay, there's a movement within the trans community currently to say that all you really need to do to transition is understand what you're doing, be an adult, and sign on the dotted line. I personally think that that's a really bad idea, and I've seen really bad results from this. I'm a strong believer in using the WPATH guidelines, of seeing a counselor for some time and really examining this in some depth. This is one of the biggest decisions anybody's going to make in their lifetime. It's going to affect everything about their life from now on. It's not something that you want to do on a whim. I have had the experience of having a patient referred to me, quote unquote, with informed consent, show up to start hormones who was floridly psychotic. Not a good choice. That patient ultimately went on to transition, but only after their psychosis had been treated and controlled. I think it's a much better choice to see a counselor for a period of time, ask the hard questions, and really consider this and really consider the consequences of this before you embark on hormone therapy. I have also seen cases where patients who had informed consent only took hormones for a period of time, decided that this was the wrong decision, and detransitioned, and then had to deal with all the effects, the permanent effects of the hormones that they'd taken. I've also seen cases where patients who embarked upon this became very seriously depressed and committed suicide. So it's not a decision to be taken lightly, and I'm strongly against informed consent only.
Could you tell us a little bit about how long the hormones need to be taken?
Generally, once a patient starts transition, they take hormones for the rest of their life. It's not just a matter of causing the changes to alter the secondary sex characteristics. It's also a matter of relieving the gender dysphoria, or the feeling of unease of having lived in the wrong body or with the wrong hormones. And generally, trans people feel very bad if they have to stop their hormones, especially if they still have the organs that are going to start producing their natal hormones, which contributes to the gender dysphoria in a major way anyway.
Could you go over some of the physical and emotional side effects of taking hormones?
Okay, well, let's deal with the emotional first. Most patients who take hormones for a couple of weeks and say, oh my God, where has this been all my life? I suddenly feel like a normal person. There are a few individuals that don't feel that way. They start hormone therapy and they say, oh my God, I feel terrible. And some of those people have discovered that this is not the right path for them. Some of those people decide, this is the right path for me. I want to live as I feel, but hormones aren't the right path for me. So it just depends on the person and what they feel comfortable with.
So you're saying that there's no set time frame that someone has to be taking hormones. It's
an individual decision, but the vast majority of trans people will take hormones for the rest of their life.
And along with hormone replacement therapy, what kind of monitoring is necessary for continued use?
Well, anyone who's taking hormones needs to have their blood pressure taken regularly. They need to have regular lab work to measure their hormone levels. When the trans medicine was first starting out, we gave fixed doses of hormones, which frankly were far too large. And that caused a lot of complications, especially in the cardiovascular area, stroke, heart attack, and blood clots. Now we monitor hormone levels and try to hit certain targets for a male to female. It would be for estrogen levels and to make sure that testosterone is suppressed, and for females to males, it would be to make sure that they have adequate levels of testosterone and that estrogen is suppressed. It's important to monitor things like cholesterol and blood pressure and risk factors for cardiovascular disease. All the things you would normally do for any patient. Don't get fat, exercise, eat right, all those things.
All the stuff that doctors tell you anyway.
That's right.
Mm-hmm. Well, let's see. And what happens if a person goes off of hormones, just stops taking them?
Well, if a patient goes off of hormones, the effects of the hormones they're taking go away, and if they still have their natal organs, ovaries or testes, then their natal organs start producing hormones again. For a lot of people, that causes a big resurgence in their gender dysphoria.
Could you tell us a little bit about what side effects are normal, what are abnormal, and when should you be at notice and go contact your doctor immediately?
Well, first of all, if you feel terrible taking hormones, you should stop the hormones immediately and talk to your doctor. There are certain things that we expect to see. Basically we're creating an artificial puberty here, and I tell patients to expect to go through puberty a second time, and hopefully they won't be quite as stupid as they were the first time. But a lot of the things that we see in puberty, like acne, changes in skin, changes in hair, and so forth, are common with hormone therapy. For a male to female, we expect to see body hair diminish and go away. Unfortunately, beard does not go away. That has to be removed with electrolysis. For females to males, we see body hair develop. We see a beard develop over a period of time. That often takes as much as 5 years. The voice begins to deepen. Skin becomes more coarse, so forth.
So the voice does not change for male to females because of hormones? Like you can't take hormones and then your voice will suddenly get higher pitched?
No, because when you're larynx was first exposed to testosterone, it actually got bigger and the vocal cords got thicker, and that's a permanent change. So the voice does not automatically get higher if you start taking estrogen. There are some so-called tricks of the trade to make you sound more feminine. Men tend to resonate their voice in their chest. Women tend to resonate their voice in their head. Women tend to speak with a lot more inflection than males. Men tend to speak kind of in a monotone. Males tend to end their sentences with a down note, and women tend to end sentences with an up note. So there's a lot of things that can make you sound a lot more female without changing your pitch.
We know that some of the people watching today have children who they may be unsure are trans or gender nonconforming. When should the parents of children start talking to doctors?
As soon as they suspect that something might be wrong. The sooner you involve your physician, the more likely you are to have a good outcome. If it's a very young child, allowing them to express themselves is generally a good thing. And as soon as they develop language skills, if you ask them, they will generally tell you what gender they are or what gender that they feel. Some of them will insist that they are, if they were born female, that they're a boy, or vice versa. Some will recognize that they were born as they were born, but they feel differently. So, your pediatrician or family practitioner can help you sort that out in the beginning. If it's a persistent feeling, then a counselor experienced in gender issues of children needs to be involved. And they can help guide parents as to when it's time to allow the child to live full-time in their preferred gender, and when it's time to change names and so forth.
What does hormone replacement therapy do to female to male patients, and what should they expect? How is it administered?
Okay, well, there are several options for administering testosterone. Most common is by injection. That's what I have the most experience with. It's generally given weekly or every other week. I prefer to deliver it weekly because you see less high peaks of hormones and low troughs of hormones and more of a steady state, which is generally better tolerated. It can also be administered by testosterone gel, which is applied to the skin. The problem with testosterone gel is that in order to give enough testosterone to reach target levels, you have to use a lot. So you're covering yourself with this stuff. And certainly for the first 2 hours, and often for up to 12 hours, if somebody rubs against you, they're going to get a certain amount of testosterone transfer. So that's not necessarily desirable. There are also testosterone patches, which are applied to the skin, but the adhesive on these things is phenomenal. It's like putting glue on you, and we actually use adhesive remover, which is commonly used to remove ostomies for colostomies and so forth, to remove these things. And even so, a huge number of these patients will develop severe rashes under the skin where these patches are applied because of either sensitivity to the adhesive or just irritation from trying to pull the things off. Unfortunately, we don't have an oral testosterone regimen. That has been tried in the past, but unfortunately causes big liver problems, so that's not really an option.
And conversely, what does hormone therapy do to male to female patients, and what should they expect, and how are hormones administered?
Okay, so male to females almost always receive oral therapy. There's two medications that are used. One is spironolactone, which was developed as a diuretic, but we found that it inhibits testosterone. So in high doses, it's used as a testosterone blocker. And the second is estradiol or estrogen. Estradiol is the estrogen that natal females make, so it's very similar. You can administer estrogen as patches. That's commonly done. The advantage of patches is that it doesn't have to go through the liver first, so lower total doses can be used, and it does go directly into the bloodstream. You can administer estrogen by injection. I strongly discourage it because you tend to have extremely high levels of estrogen right after the injection and very low levels of estrogen before you're due for another injection. And that kind of tends to take you on an emotional roller coaster. We also know that the very high levels of estrogen are more associated with increased risk of blood clots and other cardiovascular disease such as stroke or heart attack.
And what kind of dosages? I hate to get into dosage amounts, but what is the average dose amount that you give to male to female patients or female to male patients so that they can better understand and know when they talk to their doctor?
Okay. For female to male patients, we generally start with 50 milligrams of testosterone per week. And that can be, that's injection. And by topical, it's, I think, 4 pumps a day, which would be 50 milligrams a day. Obviously, not all of that is absorbed, but then you measure levels and you adjust accordingly. For a male to female, we generally start with 200 milligrams of spironolactone and 4 milligrams of estradiol, and then again, after 4 to 6 weeks, check levels and adjust to hit targets.
Thank you very much for helping us understand a little bit better today. I enjoyed having you on the show, and I look forward to working with you in the future as well.
Thank you.
Hello, my name is Amy Layton,
My name is Ari LaTourette.
and this is Tea Time in Olympia. And today we're going to be speaking with Ari about WA Safe Alliance. So let's delve right into it. Could you please tell us a little bit about WA Safe Alliance?
So the SAFE in WA Safe Alliance stands for Safety and Access for Everyone. And the Washington Safe Alliance is a coalition of organizations and individuals who are coming together to defend the long-standing anti-discrimination law in Washington state, and more specifically for transgender individuals living here in Washington.
Why do you feel that it is important for businesses to get involved?
I think that one of the most important things about the WA Safe Alliance is community support, because transgender people are a part of our community. You know, we work in town, we go to school, we have lives, families, we own businesses, and we are the patrons of businesses. And one big thing that local businesses can do in order to show their trans patrons that they support them is to sign on to the Washington Safe Alliance. There's no requirements, no money donations, no nothing, but it's just signing your name down and saying, hey, I own a business, or I work for myself, or I'm an individual living in the Washington, whatever county you're in, and I support trans people. I value them as members of our community, I value my patrons, and I want them to have equal rights. And that can be a very powerful message coming from members of our community, business owners as well.
So Ari, what can local businesses do to lend their support?
Well, the first thing that local businesses can do in order to show support is to sign up for the Washington Safe Alliance. And all that does is it puts your name on the list of supportive businesses. There's no real requirements beyond that. And that allows us to say, hey, we have over 150 businesses who are in support of trans patrons. They want to protect anti-discrimination laws. They believe their trans patrons, their trans employees, belong here. They belong in our community and they deserve equal rights. So one very powerful, very easy way to support the WASAFE Alliance, just sign up. Another thing is when you sign up, there's an optional checklist of other ways you can contribute. And if you want, you can help by joining your local WASAFE Alliance chapter. And we have chapters across various counties: Thurston County, Pierce County, King County, and others are upcoming. Another thing I would also add is that there are a lot of benefits to businesses who want to join up with WASAFE Alliance. They can get access to a lot of resources. We have people on board who give training to businesses, give media training. So what do you do if the media asks you about transgender discrimination law? What do you do if somebody comes to your business with a question about how you deal with trans patrons, how you'll be following this law? And we can help connect them with training so that their employees are prepared. Their employees know how to respectfully deal with trans patrons. Their employees won't get caught unawares by questions that might come up. And that's a very powerful resource and a tool because, as we all know, something being just put into law does not always mean that that's just how it is, right? There's a lot of extra training that needs to be done, a lot of education, and right now a lot of that education isn't there. So by signing up for WASAFE Alliance, not only can local business owners help themselves by showing that they support, that they support everybody, they support their trans patrons, they help trans people by doing that, but also they can gain access, access resources for their own company that will empower their employees and basically keep them safer and more educated.
How can interested businesses contact you to join the list?
So local businesses or businesses all across Washington can join the list by going to the Washington Safe Alliance website, and that's just wasafealliance.org. There you can look at our partners or coalition partners, and there's a sign-up form right there. Another thing that local business owners can do is get in contact with your local chapter. Our local chapter here in Olympia has a Facebook group where we post meeting times. In addition, a lot of information about our group is posted on Organizing Trans Olympia, which is a trans-run social media news page.
Well, speaking of Organizing Trans Olympia, could you tell us a little bit about Organizing Trans Olympia?
Yeah. So Organizing Trans Olympia is more or less, it's a social media hub for trans people in the Olympia area. And we also branch out and talk about things affecting the wider Washington community or Tacoma, Seattle, areas around. But it's centered on Olympia specifically. And it's an organization that was founded by myself and Tali Abernathy Jones, who, when we were getting together regarding the transmisogyny counter-protest that took place on February 15th of 2016. At that time, we were thinking about we had ended up as the main organizers for the protest with the help of a lot of great organizations such as the Gender Justice Alliance, PFLAG, Stonewall Youth, a whole lot of others. And we needed a page to get information out. We needed to make an event page, and we didn't want to necessarily open our home address up to that's dangerous. So we had the page made, and it became an idea of a place where trans people can go to get news relevant to them, where we can find out about all the queer events. Because one thing that happened to me while I was getting involved in all of this protest organization is I realized that there are more than 20 local organizations just based here in Olympia that are queer friendly and specifically trans friendly. And that was a big shock to me, even though I've lived here for over 6 years.
It shocked me too. It surprised me as well.
Yeah, and there's so many, but they don't always talk to each other. Or it's either they don't talk to each other or all of the same people are in all of them, if that makes sense. Like you'll find one person and they're involved in like 5 different groups, you know? And the sad thing is that a lot of the time people don't even know about these organizations. They don't know what resources are there to help them. So we have been working on making that a reality, getting the word out about these organizations, helping the organizations come into contact with each other, work in collaboration with each other. So we try to act as a central point where we can share all of the events for fundraisers they're doing, fun dances, or anything like that, and as well as helping individual trans people who may not be associated with these organizations. We help advertise trans-run businesses. We can help advertise businesses and medical facilities that help trans people, help give access. We have upkept a list, which is also done by Masa from Stonewall Youth, of trans-friendly medical professionals in the area, and we try to get the word out about that. And any cool project that trans people are doing. We showed the promo for Tea Time in Olympia, for example.
Shout out.
Yeah. So it's basically anything trans related. So any trans people who are, watching this and are like, I have an art show coming up, or I'm doing this blog that I like, or anything in your life, or if you just want to introduce yourself to the trans community, we can do a little op-ed kind of thing, like your picture and then a little bit about yourself. Feel free to send us a message on our Facebook page or email us at organizingtransolympia@gmail.com.
Well, that was very, very informative. And I just have to say, Organizing Trans Olympia is such a good hub for all the information on what's going on and the need to know kind of information that everyone can come to and find.
Thank you.
And thank you for making sure that happened. Like you said, a lot of organizations, they get kind of disconnected, and I really believe that it's great that you're coming together and bringing them all back together.
Appreciate that. I didn't want anybody else to have to deal with the situation where I was in, where I was like, I've been here for 6 years, I don't have very many resources. Oh God, I met the right person, and suddenly all of the resources are here. So it's better if it's somewhere where people can easily accept it, easily get it. And I think that's something that happens in the trans community, because we're a community that does experience a lot of violence. Not equally, trans women and trans people of color experience the vast majority of violence against trans people, but as a community, we often learn a lot through word of mouth. We learn what doctors are good, because we can't always trust the words of anyone other than fellow trans people. So that is why having a central hub like this, where it's public knowledge and it's not just learning through friend of a friend, is something that we felt was really valuable.
And it is. If you are interested, there will be links to the website, or links to Organizing Trans Olympia in the description of this video, as well as on the bottom of your screen, And also WASAFE Alliance, we will have that information in the link as well, and on the bottom of the screen. Thank you for joining us as we learned more about WASAFE Alliance.
Back to Tea Time. I'm Luke Miller, and I'd like to tell you about some upcoming events in Olympia this June. This year, Capital City Pride is hosting the 26th Annual Pride Festival and Parade in downtown Olympia, Washington, kicking off Friday night, June 17th, and running through Saturday, June 18th, and Sunday, June 19th. Capital City Pride hosts the biggest small-town festival in the Pacific Northwest. Capital City Pride is a family-friendly event that is free and open to the public. We'll have kickoff events Friday, June 17th at 7 p.m. at the Ole Underground at 109 Legion Way, including a fire show at 9 p.m., The festival will begin Saturday, June 18th from 11 a.m. to 5 p.m. in Heritage Park at Water Street and 7th Avenue Southeast and continue through Sunday. The parade will be Sunday, June 19th from noon to 1 p.m. from the Capitol Steps down Capitol Way to Heritage Park. Pride 2016 brings together the gay, lesbian, bisexual, transgender, and allied communities to celebrate, promising something for everyone. According to Pride Chair Anna Schlecht, what a difference 25 years makes. We launched our small town Pride 25 years ago with 400 people marching on the Capitol for gay rights. Now we are one of the biggest summer festivals around. Since then, we have made huge strides toward full equality, and the greater Olympia area embraces us and the Pride Festival as part of the community. Once again, we hope to paint the town rainbow, and we invite everyone to join us in celebrating our 26th anniversary of Pride. The entertainment lineup this year will feature old favorites like the Kim Archer Band, an R&B band from Tacoma, one of the hardest working dance bands in the Pacific Northwest. Also returning will be Xavier Toscano and his high-octane dancers from the Bay Area. And the awe-inspiring Caravan of Glam from Portland, a vaudeville meets drag troupe who are coming off their star turn on America's Got Talent. Other musical surprises are in store over the long Pride weekend. The Pride Parade, scheduled for noon to 1 p.m. Sunday, June 19th, is always the highlight of Pride. Entries will include flashy floats, marching contingents wearing rainbow-themed bling, rounded out by drag queens from near and far who will serve up that marvelous concoction of Las Vegas-style glamour on high heels. According to Gina Thompson, parade coordinator, "While I've worked on the parade for a couple of years, this is my first time coordinating it. I love how our parade not only celebrates the diversity within our community, but proudly and tastefully displays it for all to enjoy." Thompson continues, "Pride is a family-friendly event that invites the general public in not only recognizing the sacrifices and efforts that went into this cause, but also honors the achievements and the future of our GLBTQ community. That's something that I am very proud to be a part of." Well said, Gina. With nearly 100 booths, a robust family activity center, and the ever-popular fabulous food court, Pride 2016 will spring up like a one-weekend LGBTQ city near Capitol Lake. Encircled by banners and tall rainbow flags, the Pride Festival grounds create the perfect place to honor diversity and celebrate Pride in Olympia. Pride Day has grown since 1991 to become one of the most vibrant community festivals in the Thurston County area. As the first Northwest small-town Pride to be hosted outside the safety of a big city, the Olympia Pride Festival has grown from a small march for equality to one of the largest festivals in the county. We now draw nearly 15,000 people into downtown Olympia for a series of events that truly brings together all parts of the community: gay, lesbian, bisexual, transgender, and straight from around the Pacific Northwest. For more information, please visit the Capital City Pride website at www.capitalcitypride.net. And join us Saturday, June 18th, shortly after Pride festivities conclude for the day, at the Olympia Center in Toasting to Community Strength and Wellness with Mpowerment Washington, a local statewide nonprofit dedicated to furthering outreach and education for communities that are disproportionately affected by HIV and AIDS. Mpowerment Washington supports and promotes safe sex practices and community wellness, in addition to fostering positive spaces and events for all members of our local and surrounding LGBTQ community. The doors will open at 5:30 p.m. and dinner will be served at 6:30. A champagne toast and cake cutting will follow dinner. Take advantage of early discount ticket pricing if purchased by June 7th. General admission tickets can be purchased for $40 per ticket, online or at the door. Come celebrate the strides we have made as a community while working towards ensuring that the realities of living with HIV and AIDS become a thing of the past. For more information about Mpowerment Washington and for details regarding their 2016 Olympia Pride event, visit www.empowerwa.org. Thank you.
So let's see, Luke. How far does the trans history in this country go back?
At least to the 19th century, and continuing up to the present day.
Where did it all begin in the U.S.?
In the U.S., well, the city of San Francisco and the city of New York were really kind of the ground central points of staging for some of the original trans activists and organizations to take shape. Dr. Harry Benjamin, who came to the U.S. Just after the Second World War, was the pioneer sexologist who began to advocate for surgeries for transsexual people and to make a practice of treating transsexual people. And in 1966, he published his book, The Transsexual Phenomenon, which was really kind of a watershed moment for the trans community because for the first time, SRS became available in the United States.
And when were the first SRS or gender confirmation surgeries done?
Well, the first documented surgeries that we know of, Dora Richter had SRS in 1931 in Germany, done by a colleague of Magnus Hirschfeld and Dr. Harry Benjamin. And the first female-to-male surgery that we know of was done in England in 1946 on Michael Dillon, a minor member of the British peerage.
Let's see.
So surgeries had been available overseas for quite a long time. It took a little longer for them to become available in the U.S. Because of some legal decisions that were made in the late 40s, early 50s.
So the LGBT movement, or the trans movement, was really started back in the 50s?
It started earlier than that because, of course, in the beginning, the transgender movement was still kind of embedded with the lesbian, bisexual, and gay movement. Although back then it was really just the lesbian and gay movement. But some of the first gay activists, the changes they made, the progresses and the cases they won, benefited the trans community as well. But it wasn't until perhaps the mid-1960s that the trans community really began to diverge and become a movement unto itself. And then during the 70s, there was a pretty big split between the gay movement and the trans movement. And to some degree, that rift has still not been fully healed.
What were some of the first activism/organizations for LGBT, the movement in the U.S., particularly the T part of that equation?
Well, some of the first trans organizations began, again, mostly in San Francisco and New York. A lot of them were focused on helping trans people transition, not so much for like greater political progress. And then, of course, after the late 1960s, the Stonewall riots and other incidents like the Compton Cafeteria riot and the Dewey lunch counter incident, there was a big surge into more radicalism as the GLBTQ movement merged with other civil rights movements like the Black Civil Rights Movement and the anti-war movement and the women's movement, and took a decided turn to the left for pretty much everybody. There were early organizations for cross-dressers, and there were on the other side of the tracks, I guess you could say, there were organizations for queer street youth, like Vanguard, that was started by the Glide Memorial Church in San Francisco, and several others.
Could you tell us a little bit
Yeah.
about some of the organizations that started here in Olympia? Like, when was the first one that you know of started here in Olympia?
The first trans organization that I know of, I only moved out here in 2003. And at that time, there was an organization called the Gender Variant Healthcare Project that was started by some former Evergreen students that I hooked up with on the advice of my therapist. I got on their board. And the idea behind that was to make general health care friendlier and more accessible to transgender people. Among other things, our purpose was to go out and do sensitivity trainings for doctors and healthcare providers. We also tried to make some progress toward making transition care more available. And we did a lot of community building and cultural work toward building a transgender community.
What kind of social context did the trans movement in the U.S. take shape in?
Well, the beginnings, of course, Harry Benjamin came to the U.S. from Nazi Germany, basically. And in the pre- and post-war years leading into the 1950s, the McCarthy era, that was an era when, among other things, the women's movement was taking shape, and servicemen were coming home from the war theaters and wanting their jobs back that that women had taken over while they were overseas. So there was a big kind of upset in traditional gender roles, and this kind of created the context in which gay and gender variant and other sexual and gender minorities could start to carve out a social niche for themselves with the breaking apart of that rigidly conformist heterosexist family system. And then, of course, in the 1960s, with the Cultural Revolution and the, changes in gender styles for everyone, that created more opportunity for, expansion of gender expression.
You've mentioned the gay movement, or LGBT movement, as it later became, and the trans movement.
Yeah.
What is the relationship between those two movements? And I know they started together, but why did they necessarily split?
Well, they started together because in the public mind, of course, gender and sexuality have been, interconnected, for such a long time in public discourse. But as gender roles began to be more deeply questioned in the 1950s and 60s and 70s, the differing issues for sexual minorities and for gender minorities became clearer. One of the things that happened, for example, was homosexuality was delisted from the DSM as a mental disorder. Gender identity disorder, however, remained in the DSM as a way for transgender people to get access to the medical services that they needed to transition. And so that represented a big philosophical split because the gay movement really wanted to be done with the medical establishment, but the trans community was still tied to it in many ways. Also, there was a lot of investment in gender conformity within the early gay movement, which consisted a lot of white middle class, very gender normative people who wanted to hang on to their privileges. And to the extent that many trans people were poor or people of color or living on the margins of society already, they had less investment in that system.
I look forward to hearing more and learning a little bit more each time I talk with you.
Anytime. The producers of Tea Time have asked me to bring up an issue they feel is important. In 2016, states across America began to introduce harmful legislation and initiatives that seek to repeal non-discrimination protections and restrict transgender people's access to gender-specific facilities like restrooms. The sponsors of these measures claim that these proposals are necessary to prevent sexual violence and to protect women and children. All of the evidence shows these claims are false. Over 200 municipalities and 18 states have non-discrimination laws, many of which have been in place for decades, protecting the rights of transgender people. None of these jurisdictions have seen a rise in sexual violence or other public safety issues because of these laws. Assaulting another person in a restroom or changing room remains against the law in every single state. These laws do not allow men to go into women's restrooms, period. These claims are based either on a flawed understanding of what it means to be transgender or a misrepresentation of the law. Discriminating against transgender people does not give anyone more control over their body or security. Those who continue to spread falsehoods about transgender people and the non-discrimination laws that protect us are putting transgender people in harm's way and making no one safer. We refuse to stand by while the needs of survivors, both transgender and non-transgender, are ignored in order to push a political agenda that does nothing to serve and protect victims or potential victims. We at Tea Time feel these initiatives are not really about where people pee. They have a more sinister goal of repealing civil rights. Attempting to strip the Human Rights Commission of their authority to make rules and provide assistance to transgender people is a much larger issue and affects our right to fair housing, equality in the workplace, and access to health care. It sets a bad precedent and allows for future challenges to the Human Rights Commission's authority to protect the civil rights of all Washingtonians, including women, children, people of color, and the disabled. Furthermore, a recent analysis determined that I-1515, if passed, will cost the state of Washington $4.5 billion in federal funding. We urge you to continue to educate yourself and to oppose Initiative 1515, titled Concerns Gender Segregated Facilities and Civil Liabilities. Thank you.